I am very pleased to announce that following extensive consultations with school boards, superintendents, parents, and teachers, Alberta's K-12 education system will reopen for in-class teaching this September, and 750,000 students will be able to return to school. Our health and education officials have closely studied the experiences of other provinces and countries, and together they've developed state-of-the-art protocols for minimizing the risk of transmission at schools. These protocols will be reviewed regularly as new evidence emerges, and any changes necessary for protecting students and staff will be incorporated. So let me be clear, the situation in terms of the protocols may evolve over time. This does not mean there will be no cases in schools. It means rather that we have calculated the relative risks of reopening against the risks of continued closures, and we've made the best decision to serve the public interest. Throughout the pandemic, Albertans have consistently demonstrated great responsibility, doing their part to contain the spread and protect the vulnerable. I'm confident that everyone in the school system will do their utmost to follow the comprehensive public health guidance that Alberta Health has developed for schools. This includes physical distancing, grouping students in cohorts to minimize infection spread, frequent hand washing with sanitizers at school entrances and in classrooms, staying home when sick, increased cleaning of surfaces, daily self-assessment, and students and staff may wear a mask if they choose to do so. We're determined to do everything we can to safely return students to class and will continue to adjust safety protocols, as I've said, as needed on the advice of Dr. Hinshaw, taking into account the experience of other jurisdictions. This decision is ultimately about doing what's best for students and parents.
The most common question that students, parents, and staff have right now is probably, how will we keep schools safe? As a parent of young children, I know this is top of mind for all of us who have direct connection with the school system. I want to stress that there is no risk-free approach to living with COVID-19, yet we still have to learn to live with it. There are no easy choices in front of us. We know, as you've heard, that extended school closures negatively impact children's overall long-term mental, emotional, and physical health. As has been outlined, current evidence indicates that school-aged children typically have very mild disease, and young children do not seem to transmit to others as often as adults. Despite this, COVID-19 still needs to be taken seriously for the health of all those in the school and others, such as the families of school children. We will almost certainly identify cases of COVID-19 in students and staff in the fall. Because of this, we are putting measures in place to protect the health of children, staff, and families by limiting onward spread within the school. As Minister LaGrange noted, there is a re-entry toolkit designed to prepare parents and students for what to expect in the new school year. Under our current guidance, things will look a bit different when students and staff return in the fall. Several public health measures will be put in place to protect everyone in class and to protect their families and cohorts outside of school. The new measures will require students and staff to monitor symptoms on a daily basis and stay home if they are feeling sick. Students must wash or sanitize their hands before and after entering school and classrooms. Surfaces at schools and on buses will be disinfected more often. Students and staff may choose to wear a mask and should be supported in choices to do so. We recognize how difficult masking would be for many students, especially at the lower elementary grades, which is why we are not relying on any single public health measure to stop the spread of COVID-19 in the school setting. Other practices, such as physical distancing, cohorting, frequent hand washing, enhanced cleaning, and a number of changes as to how classes and schools operate will also help. Keeping students in cohorts will help reduce the risk of widespread transmission by limiting contact and potential exposure to a small group rather than the entire school. Everyone in the school community will have to do their part and follow public health guidance to keep each other safe. This means that parents, students, and staff will be required to complete a daily self-screening prior to entering school each day. If a student shows symptoms while at school, they will be separated from others, and parents or guardians will be asked to pick them up immediately. If there is a case of COVID-19 in a school or school community, health officials will work with school authorities to ensure follow-up testing is conducted as needed, and all other measures are put in place to limit the spread, including quarantine of those who were in close contact with that case. Jurisdictions around the world are trying to determine the most effective ways to resume schools. We continue to watch their experiences closely. In the days ahead, we will continue to refine our public health advice for schools based on best available evidence to minimize the risks of staff and children being exposed. This is part of living in the new normal of COVID-19. We must be agile, adaptive, and guided by the evidence as it emerges. This is the best way to protect the health, safety, and well-being of students, staff, families, and communities.
There is an additional $120 million in additional funding going to all school divisions across this province in the upcoming school year. As well, there was $250 million in capital maintenance and renewal stimulus funding that was added on top of that. I know that $15 million of that has been allocated towards COVID-related infrastructure within schools. I also know that there's $363 million sitting in reserves, and we've allowed schools to have the ability to utilize those reserve funds to meet their needs in regards to COVID. As far as the education side of the schooling, if it is at-home learning, if a parent feels uncomfortable, then they would go to their school division, they would talk to them and see if they want to continue as they are right now with teacher-directed at-home learning, but it's up to the school division to facilitate that. They will need to have that conversation with the parents as to is this a short-term or long-term? Is there a desire for perhaps a blended program, perhaps homeschooling? Those are the type of conversations that happen at the school level. This is not something that is mandated or that the government will become involved with. This is definitely at a local level.